Okay.
Yes. Yes, hello.
Okay, Professor. Yeah.
So it's a pleasure and honor for me to go chair this session with my dear friend Professor Filippo, who is a president of the National Organization for Medicine in Athens, Greece. And since our speaker, the next speaker, Ilias Mosialos, can connect with us, we'll proceed with the the last speaker, which is Professor Pavlos Kymissis from New York, and he's going to talk us about the effect of pandemic on the emotional health now and post-pandemic. Please, Professor Pavlos Kymissis, proceed.
Okay, good morning. Can you hear me? Okay, I'd like to thank for this kind invitation to join your group. It reminds me we have started like 30 years ago, the World Hellenic Biomedical Association, and trying to connect all the physicians from different parts of the world. And I'm glad that this is becoming more materialized now. And we hope that this is not just only one event, but there is going to be a continuation. And hopefully the physicians from all parts of the world will be able to be connected and communicate with each other. I was asked to briefly talk a little about what happens on the emotional level with the COVID epidemic. In the United States, and especially in New York State and the city of New York, we were severely affected from the very beginning of the pandemic. The hospitals were filled to the maximum of their capacity. Refrigerated trailers were lined up outside of the hospitals to accommodate the dead, and the city morgues were filled to their maximum capacity. It has been estimated that more than 500,000 people, the latest statistics is that 550,000 people have died from the virus. This number is more than how many people died from First World War, Second World War, and the Vietnam War altogether. Currently, many academic centers are studying the effects of the virus on the body and the different systems. Many neuropsychological studies have done, and it was found that many functions of the brain are affected, including memory, concentration, ability to focus, and to pay attention. In addition to the inability to breathe, the patients had other symptoms like exhaustion, headaches, difficulty to think clearly, insomnia, but mainly psychiatric symptoms were anxiety and depression. Some patients also experienced hallucinations and delusions, and this syndrome was described as COVID psychosis. It has been estimated that about 20% of those infected with COVID-19 develop psychiatric symptoms at some point, and they require supportive psychological services. It has been found that schizophrenic patients who were infected were twice prone to die than the general population. The major psychiatric symptoms of those infected with the COVID-19 were depression, anxiety, and some others met criteria for post-traumatic stress disorder. In addition, there have been an increase of cases of family violence, self-harm behavior, suicidal behavior, and actually many cases of suicide. Although children and adolescents are less likely to be infected by the virus, it should be noted that they have been affected in many other ways during this pandemic. Some of them lost their friends by not attending school, and if a member of their family was infected, it increased their level of anxiety and fear. In addition, the stressful psychological impact of being under quarantine cannot be underestimated. The people who were discharged from the hospital and go home face fear of being reinfected, they feel helpless, frustrated, and uncertain about their future. The cognitive impairment may persist for years after the recovery from COVID-19. Also, some minority populations were disproportionately affected by the virus, and they are 2 or 3 more times likely to somebody to know that people from minorities have died from the infection. Many people during the pandemic reported that they have gained a lot of weight due to the seclusion in their homes, the lack of exercise, and the use of food as the only source of enjoyment. In addition to the physical and the neurological problems, there have been reported many social problems, such as social isolation, financial difficulties, and unemployment. Alcohol and substance abuse disorders can be exacerbated in post-COVID-19 patients, and this abuse can complicate their recovery. Many people who have lost loved ones were not able to attend their funerals, and they were not able to go through the process of mourning due to the social isolation. Another interesting phenomenon was the use of electronic communication, working at home, and distant learning for students. Initially, the idea of working from home as well as distant learning was seen as a positive and enjoyable experience. But as time went by, working from home and learning at home became an exhausting and frustrating experience. This is related to the fact that digital and electronic communication cannot replace human contact and interaction. Another serious consequence of the pandemic is the burnout of the health providers, such as nurses, doctors, and mental health workers. Many have been experiencing psychiatric symptoms of anxiety and depression and require psychological support. The mental health system is under tremendous pressure. Many patients are not even able to find professional help. As a result of this, many people have formed peer groups, support groups through the internet. A study showed that a simple phone call from a person who may not even be known to the recipient may have a positive effect in helping people to overcome the feeling of social isolation and depression. The new method of therapy, like telehealth, has been developed using electronic technology to bring the patient in contact with the health practitioner. Psychotherapy using virtual technology has its limitations, since it does not provide all the benefits of human contact. Some patients who have been on psychiatric medication and are infected by the virus experience an exacerbation of the medication side effects. We should also know that the post-traumatic stress disorder of September 11th first responders continues to exist even 20 years after that attack. Also, we have seen people suffering from post-traumatic disorder after the Hurricane Katrina. Although both events, September 11th and Katrina, were of a short duration, they had the long-term consequences. Therefore, we expect the impact of COVID-19 to remain for years to come. We're looking forward to better days ahead with the development of more effective treatments and the availability of a number of vaccines. But the anxiety of the unknown still remains. People are concerned that they are getting confusing and mixed messages from experts and so-called experts, and they are reluctant to participate in programs of prevention like social distancing, using of masks, and also they are creating problems in terms of being able to get vaccinated. The social isolation and seclusion brought up many questions relating to the meaning of life and the purpose of one's own existence. People are looking at very simple activities that were considered as a given in the past, like visiting a friend, taking a walk, changing an environment, going to church, visiting relatives, as a source of extraordinary pleasure and satisfaction. Thank you very much.
I would like to thank you, Professor Pavlos Kymissis, for your excellent talk. And since we don't have time because we overlap the time, we'll proceed with the next session.